Hello guys, welcome to my YouTube channel Exam Pharmacy. Yes, in this today's important session, we will discuss about the hyperacidity. What is this hyperacidity or GERD or acid reflux? These all are the same here. Here we will discuss some of the causes, symptoms, diagnosis, treatment with one medicine. Okay, that is a pantoprazole with a dose. It is a prescription based drug. So all my videos which has been uploading now, yes, you have to be cautious there. Okay, without doctor prescription, you should not take any medicine or any drug. And at last we will discuss about the hyperacidity prevention. How can you prevent? First one, hyperacidity. It is an acid reflux disease. It occurs when the stomach produces too much acid and it flows back into the esophagus, causing a burning sensation in the chest and the throat. Okay, very simple. When this acid produces too much HCl, stomach produces too much HCl, and that HCl will flows back to your throat region or your esophageal region. That leads to burning sensation. This one, see, you are observing here in the picture. Clear, simple idea. Next one, causes, see, overeating, being overweight, then eating citrus fruit, that which contains the high amount of citrus, orange, lemon or tomato, means these will stimulate the production for HCl. Then going to bed after eating, yes, directly going to bed, you have to maintain minimum 2 to 3 hours gap between the going to bed after eating. Maintain 2 to 3 hours. Are you getting what I am telling? And if you are suffering from GERD, eat less amount of citrus fruits. Okay, drink a good amount of water. See, this is overweight, overeating. These all are the causes. Drinking alcohol also, it is one of the major cause. Coffee, tea, carbonated beverages. Then smoking, it also leads to the this one GERD or acid reflux. Medicines like NSAID, some of the medicine that treats painkillers, what we are calling, no, like ibuprofen or aceclofenac, diclofenac, some of the antibiotics like penicillin antibiotics, amoxicillin, cefodoximine, these all will stimulate the HCl. Then a skipping of meal, it is one of the major cause, meal skipping. This is also, these are the some of the causes for the GERD. Symptoms, let's discuss. Simple symptoms has been experienced like heartburn, vomiting, hiccups, okay, bitter taste in mouth, then sore throat, cough, stomach pain. These are the common symptoms we do observe in our day-to-day life due to the acidity. Then the diagnosis, some of the important diagnosis are there. X-ray we are doing of the esophagus, X-ray, endoscopy. Okay, your doctor will set a camera inside the your stomach via mouth. Then pH monitoring, here it will monitor the pH, means through the endoscope what we are doing, we are just immersing one setup. That setup will be kept for 2 to 3 days in your stomach. That will identify how much amount of acid is present in our stomach, so that we can easily maintain the pH. Okay, so we can easily monitor that pH. Then transnasal esophagoscopy is also one type of the diagnosis test for the GERD, to know the GERD. And next one is our treatment. See, basic treatment for GERD is not required for initial step. For initial, no, it's not required treatment. But the GERD, if it prolongs or it provokes hyperacidity, it provokes nausea, vomiting, some other type of the causes with complications, then you can treat this disease. Okay, doctor will treat this. And treatment, very simple treatment is there here. Antacids that contain calcium chloride, magnesium aluminum silicate. Okay, you know that Digin tablet, syrup, Gelusil, these all contain these contents, that is magnesium, aluminum silicate, aluminum chloride, okay, simethicone contents. These will just what they will do, they will form the forming layer over your stomach walls, so that the HCl extra production can be reduced. Then next is cimetidine, that is ranitidine, proton pump inhibitors, what we are calling, no. Then proton pump inhibitors actually pantoprazole, esomeprazole, omeprazole and rabeprazole. Okay, these are the drugs which are given to prevent the hyperacidity. You are observing here pantoprazole with domperidone. Why we are giving domperidone means to prevent the vomiting sensation, to prevent the bad taste in our mouth sensation. We are giving this domperidone, and this is a better act before food. Then dose of pantoprazole, one drugs dose I will discuss here. Pantoprazole, see, adult 40 mg in a day we can give in a divided dose, or at a once we can do. Children more than 5 years, okay, more than 5 years, that is 20 mg in a day, should be given before food to have a greater effect. Before food we have to give. Then at last, prevention. How can we prevent? Maintain a healthy diet is one of the very important thing. You have to eat very adequate amount of food. Then stop smoking. Don't lie down after a meal. Avoid tight fitting clothes. Okay. Then avoid drinks that provokes acid reflux, like these soda waters, what we are calling, or carbonated beverages, alcohol, coffee, tea. We have to minimize that all. Then stop eating garlic, onion and chocolate. This also will provoke the excess production of HCl, which leads to the acid reflux. These are the common prevention. If you maintain means you can easily cure this disease, because prevention is better than cure. You have to try to prevent the diseases. Okay, if the disease is not curing, or disease is not suppressing by means of this treatment, a simple treatment, doctors do surgery. Okay, what they will do, they will make one sphincter near the esophagus where the acid cannot be reflexed back. This is the dose, treatment, diagnosis, symptoms, causes and what is actual hyperacidity. If you like this channel, subscribe Legend Pharmacy. If you like this video, then also you subscribe Legend Pharmacy. Thank you.